It's a gathering of stakeholders in the health sector as Nigerian Health Watch organized a one-day primary healthcare policy dialogue in Kano State with the theme Strengthening Human Resources for Health and Achieving Sustainable Financing for Primary Healthcare. Kano State Primary Healthcare believes one of the challenges with its primary healthcare system is funding, as the state will need about 120 billion naira, which is not available. It is, however, re-strategizing to improve its delivery for its huge population.
Kano has 484 wards, which means we should have at least 484 primary facilities providing the basic minimum PHC services in Kano. This is an enormous task. This requires enormous resources. Therefore, we re-strategize and say, no, we cannot provide such funding all at once, but we should look inward and see how we provide such facilities.
Kano State has 19,000 health workers and only 9,000 are permanently engaged, leaving a huge gap to how much financing is required for human resources.
We have the database of over 19,000 staff that are currently under the Human Resource for Health Management Information System of Kano State Primary Healthcare Management Board. And there are ongoing efforts to regularize payment. Like I said, some receive, some don't receive any payment, and even the payment that they receive is inadequate because 5,000 can only take you to even where we work.
Commissioner for Health Ibrahim Sainwa has filled in the numerous gaps in the healthcare sector policies on tax sharing. Tradings will be used to ensure quality human resources.
Based on this gap analysis, we are able to develop investment plan for this minimum service package so that we can address these gaps, this infrastructural gap, the human resource gaps, and other gaps that were identified.
Over the past few years, decades, etc., primary healthcare has been severely underfunded. And we found that with COVID-19, our primary healthcare facilities and health workers are really at the front line of not just ensuring that patients have adequate access to basic care like maternal care, nutrition, etc., but also the prevention, detection, and response of epidemic preparedness and infectious disease outbreaks. So primary healthcare really is at the front line of delivering healthcare services to all Nigerians.
Adopted policies that will improve and provide quality, accessible and affordable healthcare across the country is expected to be the outcome of the one-day primary healthcare policy.